Hey, it's Birdman for Summit Healthcare is hanging out here at the Diabetes Education Center over in the East Campus of the Summit Healthcare. With me, I've got Debby Finch. We made a joke about your last name, and
we did.
Birdman, didn't we?
That's right.
So, Debby, what's your position here at the center?
I am the program coordinator over the diabetes department.
Okay. And what's that entail exactly?
It entails a lot. We actually do outpatient education, outpatient appointments. I do quite a bit of pump training, initiation on insulin pumps as an outpatient appointment. I also see patients inpatient when I get a certified diabetes education consult. I'm also responsible for overseeing the policies and procedures related to diabetes care, both inpatient and outpatient. And I also do community events. We're recognized by the American Diabetes Association, so I go into the schools and I do a Safe at School presentation for the school districts for kids with type 1 diabetes.
Type 1 diabetes. And what is exactly type 1 versus the other types?
Type 1 diabetes is an autoimmune disorder.
Okay.
So basically the body's immune system kind of attacks itself. As with other autoimmune disorders, it destroys the beta cells inside of the pancreas that are responsible for the production of insulin. So people with type 1 diabetes are insulin deficient, and they need to be started on insulin right away. Whereas people with type 2 diabetes generally can prevent or at least delay the onset of type 2 diabetes through lifestyle choices. There's a strong genetic link with type 2 diabetes. However, it doesn't present with total insulin deficiency like type 1 diabetes does.
Okay, cool. And that's more the preventable type versus the type 1. Is type 1 preventable?
It is not.
It is not.
And there is no cure. And just to clarify, type 2 diabetes isn't always necessarily preventable either.
Oh, okay.
If somebody has a really strong genetic disposition to develop type 2 diabetes, in other words, if they have a family history of type 2 diabetes, then they may not be able to prevent it. However, through lifestyle choices, activity level, food choices, they can definitely prevent or delay the onset of type 2 diabetes for much later in life.
Very interesting. I have a brother-in-law who has diabetes, and he has to deal with. And he's he stays pretty fit and things like that. But boy, if he doesn't watch it, he can put himself in a pretty critical situation rather quickly.
Right.
Yeah.
And whether a person has type 1 or type 2 diabetes, lifestyle choices are important. Even with type 1 diabetes, even though people with type 1 diabetes have to take insulin, it's still important that they make wise choices about their nutrition and that they maintain an active lifestyle, because then their body is more sensitive to the insulin that they're taking, and they respond better to the insulin.
Okay. We talked previously with Ms. Moffat about the fact that prevention is important and talking about support groups and things like that. You talked about one thing here, which was pump training. Can you take me through a little bit about that? Because I'd never really even considered about the fact that there's obviously sometimes give me the different options for pumps, first of all, and what that entails.
There's a really large misconception about insulin pumps. People think that if a person with diabetes is on an insulin pump, the pump takes care of everything for them, and it does not. The pump is a fancy, sophisticated insulin administration device. So I tell people, if you look at an insulin pump and you look at an insulin syringe, they both do the same thing. They deliver insulin.
Right.
The pump, though, can be programmed to deliver insulin more precisely to that patient's needs, whereas an insulin syringe can't.
Right.
So when a person who is using insulin for their glucose management decides or is advised to start an insulin pump, because they are pretty sophisticated and can be complicated, more because they're new to the user, they come to see me to start their insulin pump, to get trained on their insulin pump. And the insulin pump basically consists of 3 components. There's the pump itself, which is a mechanical device that's programmed. There's a reservoir that goes inside of the insulin pump that holds the insulin. And then there's an infusion site. And those infusion sites are changed with the reservoir about every 2 to 3 days. And the patient does that themselves, and they learn how to do that. And then they learn how to actually operate the pump.
So that's more that when you say that site, that's more of like where we put the needle, right?
Most sites are inserted with the needle, and then the needle is removed. I tell people to think of it kind of like an IV line, where an IV catheter will go into a vein, and then the needle is removed, and all that stays in the vein is a flexible plastic tube. An infusion site for insulin is very similar to that, except it does not go into a vein. It just goes into the fatty tissue of the body, so it's subcutaneous. Oh. And the needle is removed, and just a short, small plastic cannula is left under the surface of the skin for the insulin to be delivered through.
So let me make a statement, and you tell me if I'm correct in the statement of what I sort of understand from the pump side of things. The pump doesn't know when you ate. It doesn't know what you ate. It doesn't know when you exercised, and it doesn't know for how long, right?
That's correct. Okay. It does not have a brain.
Right. Okay.
So you have to tell the pump.
So you have to tell the pump that. But once you tell the pump that, then instead of just taking like an injection and putting in, I'm going to say 5 milliliters. I have no idea, but 5 milliliters.
We would call it units.
Okay, 5 units.
There you go.
It will do maybe a quarter unit now, a quarter unit later. Does it taper it out? Is that how it does it more precisely? Or?
Yes and no.
Okay.
So typically people that are on what we call multiple daily injections take 2 types of insulin.
Right.
They take a long-acting insulin, and that's typically injected once a day, sometimes twice a day, and then they take a rapid-acting insulin with meals. So the pump will do what you were talking about. It's programmed to deliver a small amount of insulin every hour throughout the day to cover that long-acting insulin need.
Right.
That's called basal insulin.
Okay.
And then the pump user has to pull the pump out and physically use the pump every single time they eat to enter what their blood glucose value is before their meal, to enter how many carbohydrates they're eating, and then the pump will deliver the amount of insulin that they need for that meal.
So now I understand what my brother-in-law does.
Now
Because
you
I've
understand?
seen it happen, but I've sort of, you can only speculate instead of questioning him, which is kind of odd sitting in front of a bunch of people. So, no, that's interesting.
Is he on an insulin pump?
Yeah, he is on a pump. We finally got him to go on a pump because he fought being on a pump forever. But like you said, it didn't really matter. You still had to do it. But the pump makes it easier for the management.
It does.
Yeah.
And it makes the management more precise so that the person with diabetes can get their blood glucose values closer to target.
Yeah.
Can I tell a quick story?
Absolutely. Please do.
My daughter has type 1 diabetes.
Okay.
She started on an insulin pump when she was 10, and she recently has started on a newer pump that's available on the market that's a hybrid closed loop system. She started on this pump probably about 6 weeks or so ago, and the first night that she was on this hybrid closed loop system pump, her blood glucose values remained in target the entire night.
Oh, wow.
And that was the first time that had happened to her since she was initially diagnosed with diabetes.
Wow. So pretty phenomenal.
Pretty exciting, the technology and the advances that they're making in diabetes management.
Yeah. So one other thing, and I don't know that they're available up here, and I don't know how widely they're available at all, but I know because of my brother-in-law, there are actually dogs that can sense diabetes level.
Yeah.
And it's funny because they're actually bomb sniffing dogs that failed as bomb sniffing dogs, but they do really great
with diabetes.
With diabetes. Are you aware of anybody up here with a dog like that?
I can tell you, I am not personally aware of anybody with a dog that has been trained to notify a patient with diabetes that there's something out of range with their glucose values. Mm-hmm. My sister-in-law is a veterinarian. She's very knowledgeable about that. But I can tell you from personal experience, just our home pet, mm-hmm. our personal pet, slept every night with my daughter when she was a child. And the first time that dog came into my room, barking at my bedside and waking me up, not knowing what was going on, I let him out to go to the bathroom. I gave him some water. I gave him some dog food. And he still was constantly running to the set of stairs leading up to my daughter's room. Finally, it dawned on me, maybe I should go check her blood sugar. And when I did, she was hypoglycemic.
Interesting. Yeah. So don't discount all of those kind of ways that can be known.
They're pretty amazing.
Cool. Anything else you'd like people to know about Summit Healthcare as a whole, or the Diabetes Center specifically?
Well, I can tell you that I think Summit Healthcare really promotes public health, community engagement and involvement. We really want people in the community to come in and be educated and understand their health condition. There's a lot of misconception about diabetes. There's a lot of negative stigma that surrounds people with diabetes. And I think we need to, as a community and as a diabetes world in general, kind of do away with the blame and shame of diabetes, because there's not any blame and shame. It's where are we now, and what are we going to do to move forward with what we have at this time in our lives. And I tell people all the time that the diabetes way of life really is the way of life for all of us.
Yeah.
If we would all live our lives the way that people with diabetes are taught to live their lives, we would be much healthier overall.
Very good. Well, thank you very much for your time today. I appreciate it.
Thank you.
That's going to be it for this episode of Summit Healthcare's I'm Birdman, reminding you, be healthy. Hey, make sure you follow us, because Old Fabian has a 5-story office.
5 stories.
Click up there, click down there. Yeah.